This is Patricia Bentkowski, 210 student nurse, Duville, assessing abdomen, legs, along with Perla. First, the exam table has been sanitized and cleansed. My side tray table has been cleansed and sanitized, along with my stethoscope, the diaphragm, the earpieces, and I have a pair of gloves here, and I have a blanket for my patient. So I'm going to begin. First, I'm going to wash my hands. There's a sink here. I'm washing with soap and water, about 20 seconds, well, for 20 seconds. Okay, I've dried them off. Okay, so I'm going to begin now. Hello, my name is Patricia. I'm a Duville student nurse. I'm going to be doing an assessment today on your abdomen, legs, and also a little bit on your eyes, called Perla. Could you state for me your full name and date of birth?
Paul Joseph Bentkowski, 10/13/1956.
Great. Thank you, Mr. Bentkowski. Okay, the first thing I'm going to do is check your eyes. What I would like for you to do is to look past me at the curtain and focus on a spot on the curtain. Okay, and I'm going to flash the light in your eye, each eye 2 times. Okay, so just keep focused.
Yes, ma'am.
Okay. Now I'm checking your other eye. Okay, perfect. Now, once again, look at a spot. Okay. Okay, great. Now what I want you to do is look at the tip of my pen light and just follow it. Just keep your eyes on it. Okay, great. So that was Perla. His pupils are, which Perla means pupils equal, reactive, round, reactive to light, directly and consensually, with accommodation noted. Okay. So now, Mr. Bentkowski, I'm going to put a blanket over you for your privacy. And I'm going to ask you to go ahead and lay down. Lay down as flat as you can for me. Okay. Your legs flat. If we can get you scooted up a little bit more.
Yes,
Just a little more.
yes, ma'am.
Okay. 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 You can put your legs down. Okay, that's good. So the first thing I'm going to do is I'm going to inspect your abdomen. So I'm going to lift your gown up to about here, to your breastbone, and I'm going to pull this blanket down just below your groin area. Okay. Okay, so now what I'm going to do is I'm going to inspect it. First thing I'm going to do is inspect. I'm going to look and see. I would say his abdomen is somewhere between round and protuberant. It's not really protuberant, but it's It's roundish. The temperature is warm. Tone. Um, there's no noticeable uh, scars, lesions, moles, tattoos, freckles. Um, tone is consistent. Skin tone is consistent with patient's ethnic background. Warm to the touch. Okay. Now, Mr. Bentkowski, for my next, what I, oh, and his umbilicus is midline. It's inverted. I'm going to auscultate. Your abdomen is 4 quadrants. And I'm going to auscultate, which means listen, with my stethoscope to each one. So you will feel my diaphragm 4 different times on there. Have you used the bathroom urinated within the last 30 minutes?
No. The last 30 minutes?
Yes. Have you gone to the bathroom within the last 30 minutes?
Yeah.
Okay.
Yeah.
Okay. So you've emptied your bladder. Okay, good. Okay. Okay. So I'm going to begin. Bowel sounds present in all 4 quadrants. Okay. The next thing I'm going to do is I'm going to palpate or touch your abdomen with my fingers. I'm going to do it 2 different times. One is going to be a light pressure, one is going to be a deeper pressure. Now, do you have experience any tenderness or pain in your abdomen right now?
No.
Okay. So as I'm doing this, if you do feel anything, please let me know. So I'm starting in the lower right quadrant. Now I'm going to go to the upper right quadrant. Now I'm going to the left upper quadrant. And now to the left lower quadrant. Okay. Abdomen is soft. No masses. Um, don't feel anything unusual here. Okay, now I'm going to do it again. I'm going to do a deep palpation, which is about 3 to 4 centimeters. Light is about 1 to 2 centimeters. Okay, I'm going to start in the same pattern. Your lower right quadrant. Now the upper right quadrant. Now the left upper quadrant. And now the left lower quadrant. And I'm also going to palpate the groin area lightly, which should have been done when I did the light palpitation. Now I'm going to do the deep. Okay, so once again, abdomen is soft, warm to the touch, hair evenly distributed, um, light palpation, good, deep palpation, no masses. I don't feel any organs protruding. So that's done. Now we're going to move on to the legs. Okay, going to lift patient's legs, the blanket up over the patient to expose his legs, and I'm going to check temperature. First, I'm going to check temperature on both extremities using the backs of my hand, the dorsal side of my hands. Okay, I'll help you. Put your legs flat, your feet flat. Okay, that's good. Okay, I checked anteriorly and posteriorly. The top femoral is warmer and progressively gets cooler as I go down to the top of the feet, the door, the top of the feet. Now I'm going to check for some pulses. I'm going to start with the femoral. Now I'm going to check the popliteal. Now the tibial. And the last pulse is going to be the dorsalis pedis. the dorsalis pedis, which is here. So pulses. So pulses, femoral, popliteal, tibial, and dorsalis pedis are 2+ equal. I'm also going to inspect. Going to inspect, which actually inspection should be first before I've done any of the pulses. So I see skin tone is pretty much even for ethnic background. It's warmer and then it gets cooler to the touch. Patient does experience decreased venous return, so lower parts of his lower legs are a little bit cooler than what normally would be. And there's just a little bit of slight modeling. We have some viscosities, very, very slight. We have one spot of ecchymosis here. We've got a couple of scabs that have crusted over, with some slight wounds that might have crusted over. They're in the healing stage. Hair on the femoral area is evenly distributed. So we've got that part covered. Now we're going to check for any kind of tenderness, pain, masses. So what I'm going to do is I'm going to be squeezing gently but firmly the client's leg one at a time. And as I'm going through this process, I am observing my patient for any signs of discomfort. Okay? No masses, lumps, notated, patient tolerated, no grimacing. So now what we're going to do is I'm going to examine the patient's, well, first I'm going to check for edema. So using my 2 fingers, I'm going to go down the tibia, the median malleolus, and the top, the dorsus, the dorsum. Okay, so okay, there is no pitting edema, although it is noted that towards the proximal end of the tibia, the yeah, the shows blanching, shows blanching, but that is due to the decreased venous return that the patient has been diagnosed with. But there is no pitting edema. Okay. So the next thing I'm going to do is I am going to wash my hands. Well, I'm actually going to sanitize them with some sanitizer. I'm going to put on a pair of gloves. And that was, and just to go back and restate, the when I did the pitting edema, it was the dorsal end of the tibia where it began. Okay. Now I'm going to check the foot for capillary refill, each toe. Capillary refill, brisk. Checking between toes. Skin's intact. Looking at the bottom of the feet. Bottom of both feet. Some slightly dry skin. No cracking, no lesions. There's a scab formed, crusted over. Patient is a smoker, so toenails do look slightly clubbed. So toenails do look slightly clubbed. So with that, that inspection is over. I will take off my gloves. And put them in the trash. And again, I'm going to sanitize my hands. You can put your legs down now. I'll cover my patient back up. Okay, Mr. Bentkowski, your assessment has been complete. Everything looks good.
Great.
And so you're good to go.
Thank you.
You're welcome.